We are just at the magic point where a lot of folks, I think, I know we got more. I know we got more joining, but I'm going to just kind of start our intros here so everyone that joined on time can learn a little bit and get us to the point where we are able to answer questions. So tonight we're going to be talking about TruDose, and on the call we have the inventor and mastermind behind it, Tapley Holland. He's going to introduce himself in just a moment and tell a little bit about how he came up with this thing and what it is. And I just want to say from our clinic standpoint, we're seeing some pretty amazing results so far with TruDose. And it just makes a lot of sense from a naturopathic perspective. It's the body healing itself, plain and simple. And I think you'll understand how that is happening, and hopefully get to hear some case studies about things that have been occurring over the past number of years that Tapley's been working with folks with this. And you're going to have a chance to ask questions. We have a chat. You can go into the little chat area and type in some of your questions so we can get around to that. So without further ado, it is TruDose, and here's Tapley. Take it away.
Thanks, Dr. Breiner. I always kind of start, well, sometimes I start this off with people want to know how I, got into this or came up with this. And my background is in stem cell therapies for the past 20 years. But the problem is that I always ask the question, why do these therapies work for some people and why do they not work for others after just seeing, many, many different types of cases? And what I'm talking about is utilizing cells from your body to treat your body to heal you from this or that condition. And so to make a long story short, before there was the IV therapy, which is why we're on this call tonight, I had to develop a technology which solved the long-standing problem within this field, which was the dosing inaccuracy problem. And I tell people, do you want the truth, or do you want, me to just give you kind of like, some other answer? And the truth is, I had a dream one night, and within that dream, I was basically downloaded with the intelligence um, to develop this software. I don't have any coding or software experience. That's not even in my field or expertise. I'm pretty good at PowerPoint, but that's about it. And I woke up the next morning and told my wife, I said, I think I know, I think I'm supposed to build this software, and I think this is what it's going to do. And shortly into starting the company, it did exactly what I thought it was going to do, which was, if we know what dose we heal what condition utilizing cells from our own body, then we can heal ourselves. And I started out with doing things like help my knee feel better and make my hair grow. But and we solved that problem, and it was limiting to those treatments to basically one injection. And then about 8 months into the company, I had a very similar type of revelation where um, I was downloaded something sitting at the airport, and I called my wife and I said, "Hey, I know how we're going to treat our fifth child who was vaccine injured, and he became autistic literally overnight, right in front of our eyes." And I said, "I think if we infuse this back into you intravenously, um, I think it's really going to unlock your brain." And she said, "Well, what would my dad say?" And he's a doctor. And I said, "I think he would be totally against it, and I think that he would say it might even hurt you." Actually, I think that's what pretty much any doctor you would ask right now in 2018 would say. Well, it turns out that, like any autistic mom, she's always the test pilot. She tried it. Next morning, she woke up, and it did everything that I thought it could do. It was going to do, and then more. It basically unlocked her neural capacity. Her brain was working at a pace that I had never seen anything like that. And she had some tinnitus pain in her ear that went away immediately. Her whole body changed. She had her stress incontinence went away with at about the 2 week point. Her vision got better. All of these things happened to her. And if you flash forward to today, which we're close to 10,000 patients later, I can tell you where it's if we're talking about Parkinson's or Lyme disease or COVID long hauler, cerebral palsy, stroke, autism, lupus, diabetic neuropathy. If you just insert the disease condition, because it doesn't matter, because at the end of the day, what this therapy is doing is unlocking the body's potential to heal itself from conditions that conventional medicine considers that are not treatable. And so that's kind of my story. And so many people ask me, well, how is it doing it? How is this IV therapy doing all this? So if you don't, without further ado, Dr. Breiner, if you don't mind, I'll get into it.
Yeah, let's do it because the question's already popping up. How does it differ than other PRP or platelet therapy?
Is
So
it are the questions
Tabitha's
really
going to get
popping up?
into it. Yeah, you're going to
Okay.
get into a lot of it. Um, so I'm just telling people like hold your questions because a lot of it's going to be answered, and I'm sure there's going to be more questions for sure. So go ahead, let's do it.
I mean, I'll just give you one quick example. I was in Chicago literally 2 days ago, and we treated a girl who was 14 who has cerebral palsy, and she had literally overcome the disability because her dad was just military style and trying to really reteach her body um, how to overcome this neurological deficit. Anyway, she had the typical contractures in her arm, and you could definitely tell that she had something wrong with her. But after the treatment, I walked out of the room. I walked right back into the room. Maybe it could have been 2 minutes. And I immediately noticed her wrist had relaxed and it had become in line with her arm versus before it was cranked out to this position right here. And then I said, hey, let's go walk down the hall. And her walk is typically on her right side, toe heel, which is atypical. That's an abnormal gait. And as she started walking, it was heel toe, heel toe. So her whole body relaxed. And it was literally neurological repair right in front of our eyes. So without further ado, let me tell you how this is possible. Tell me when you can see my screen.
Not yet. There we go.
So that this is a presentation, and I'll go through it rather quickly because this is a presentation that I gave to the Freedom Doctors about 2 or 3 months ago. The Freedom Doctors, the ones who were treating COVID long haulers out of the gate first with different types of therapies. And the title of this presentation is Reversing Systemic Inflammation with the TruDose IV Therapy. Somebody asked in the chat, what is my back? I'm not a doctor. I'm just the guy who figured it out. And, I do have a photographic memory, which allows me to catalog a lot of things that I read. And I just puzzled this together. These are the citations for anybody who wants to check my work, what I'm going to go over this next presentation. And this is what we're going to talk about. What is PRP? How do we create it? Why it has a 50-50 success rate? How it led to me creating my technology? How that led to the IV therapy? And then what we weren't taught about platelets, and then how this therapy could potentially help you. So what is PRP? Like it's a therapy from you. It utilizes your own platelets from your own blood. And how you produce it is you take your own blood and you process it in a centrifuge to create a high concentration of your own platelets over that of your own baseline in your blood. There's thousands of articles on the safety and efficacy of platelet rich plasma, but its primarily usage is within the sports, dental, hair fields. It's not even close to what we're going to be talking about tonight. So you won't be able to read this. You won't be able to research what we're talking about because it doesn't exist. And because it's only known to be administered site specific. And that means if I have a knee problem, I should inject it to my knee. If I want to make my hair grow, then I inject it to my scalp. But what we're talking about is going to be intravenous application. And so the way that we create PRP, or really any stem cell therapy for that matter, is we have to take a volume of, in this case, of your own blood, and we put it into a tube and we process it in a centrifuge to separate the components. And during centrifugation, it separates the different components in your blood based on its weight. So the red blood cells are the heavier things, and everything else is lighter. And then you take that everything else and you put that into another canister and you process it again. Um, Sorry for the lag time. You keep processing it over a few minutes, and what you're left with is a high concentration of platelets. So, in a very layman's terms, this is like a sediment or a filtration process to, if platelets were pulp inside orange juice and we wanted to get just the pulp, centrifugation is just a way that we remove the water and we were left with just the pulp. This is nothing new. This is nothing fancy. That's how you create stem cell therapies, utilizing cells from your own blood or your bone marrow or your umbilical cord or whatever. But the problem is, like I said, there's thousands of pieces of data on platelet rich plasma using your own blood, but the success is really been 50-50. You could Google search any article right now for knee applications or anything you want to find, and you'll find evidence that it works. And then you'll find evidence that it doesn't even work against saline control. And so the reason that occurs is because no one's really ever asked, well, is there a dose response relationship to any of these therapies? And they're starting to ask that question, but they've never really said, well, what dose will heal what? And if you don't know that, then what you have there is a dosing inaccuracy problem, because we do this for medications, but it's not a very intuitive concept for stem cell therapies. And the way to really visualize what I'm talking about is, let's pretend that everybody on this call has a knee problem, and let's pretend that we're all going to get platelet rich plasma. So what we would typically do, if you go into any office right now that offers this type of therapy and they don't use the TruDose technology, what they would do is take, the 10 mils of blood from each one of us on this call. Maybe it's 30 mils of blood. And they'll take 30 from you, 30 from the guy over there, 30 from the lady down there in the corner, 30 from me, etc. So the question, and then they'll process it in a centrifuge, they'll get the platelets and inject it back into our knees. So the question is, and the question that I asked, is if we're all biologically different and we all take the same amount of blood from each one of us, should we all have the same results? Right? Hopefully the answer is no. And that's why in 2018, I created the TruDose technology. And what that essentially is to you, if you were to walk into Dr. Breiner's office or anywhere that has it, they would take a finger stick and take a sample of a few drops of your blood, and they would analyze it in our counter that we created to measure the platelets in your blood and import that into the software that I created, what I talked about earlier, which has a lot of metrics and analytics and intelligence built into it to determine one thing: how much blood do I need to draw from you individually to create the healing dose for the knee? All right. So it could be 89 mils of blood for me. It could be 174 for the guy over there in the right-hand corner. It could be 32 for the lady down there in the lower left. But we're all going to get the same knee healing dose when the process is done after we centrifuge the blood. So the software is what transformed these therapies, because now you're talking about personalized dosage in a therapeutic dose every time for disease-specific conditions. And the software is about 95% accurate to give you that healing dose. And the whole process to do this therapy takes about 45 minutes. And when I started, like I said, I just wanted to solve problems that people could identify with, make my hair grow. And I can submit to you that in many of you've probably already had this therapy for try to make your hair grow at the local med spa, and they'll give you a series of injections, and they'll really flip a coin as to whether it work or it might work or it might not work. But I can tell you that if you do the right dose the first time, and actually the hair healing dose, which the software I have knows what that is, then you'll have these kind of results. But what changed everything for me was in 2018, like I told you, I called my wife and I said, I think I know how to heal our son. And I said, we're going to do this IV therapy. And that's really what changed everything for me and my company. And I really had to stop everything I was doing at that moment and really uncover, what did I just, what did I just open up? And so now today, after about closing in on 10,000 patients, that's how people know us as the TruDose IV platelet therapy, because it's really showing to reverse things that really, um, I mean, just name the disease condition. But the question is how? How is this doing this? How is this utilizing my own blood, giving my own platelets back into me, and healing me from these conditions that are, Parkinson's, dementia, Alzheimer's, Crohn's disease, you name it. We can talk about it later, but how? And it starts with really your platelets, the platelets within your bloodstream. Because if you were to Google, what do my platelets do? If you can ask any doctor, that you're going to right now, or just do this, what do our platelets function for? What is their function in the bloodstream? This is what you would find, that they're really there just to perform clotting, which is why you don't want to have a lot of platelets in your blood if you're at risk of stroke. But during this presentation I was giving to these doctors, a couple months ago, I said, do we really think that that's all they're meant for, is clotting? I mean, read this quote right here. In many diseases, substances are formed which act as either irritants or poisons to the platelet-forming organs, and depending on their intensity, may exert their influence to increase the platelet count or reduce it. And I said, can anybody guess when this study was published? And there were a number of answers in the gallery, but nobody guessed this. And so I said, so they knew something then, that the platelets are more important than just clotting. And so it's either we totally missed this, or we just or we covered up something that was really more important in the bloodstream. And that is the importance of what our platelets are doing as it relates to health and disease. And at a high level, I'm not going to go through a lot of this and really bog you down, but I just want you to take away some key points to really help you appreciate why they're important. So the main thing I want to take away from this slide is that our platelets are turning over in our bloodstream at a rate of about 70 million per minute. Okay. And how are they doing that? Well, they're derived from our bone marrow, from these cells called our hematopoietic stem cells. And our hematopoietic stem cells are transferred from our bone marrow up to our lung. And what our lung does is it takes some of those hematopoietic stem cells and it keeps them over to the side. And then our lung takes those hematopoietic stem cells and turns those into smaller and larger platelets. So what do the larger and smaller platelets do? Well, many studies point to the size is related to disease. And I can tell you that larger platelets are carrying more weapons and more repair needs, which we'll get into later. Oh, never mind. I got ahead of myself. But we will get into it later. So from your bone marrow to your lungs, and then they transfer down to your spleen, which I've changed this picture, by the way, Dr. Breiner. But the main thing I want to point here is that to these doctors I was talking to, is I said, I want you to appreciate this. They're going from your bone marrow to your lungs, and the lungs keep some of them to the side, and they're turning some into big and small ones. And so our body is strategically positioning our platelets around the body that they can be easily deployed in the event that we need to respond to different stressors, pathogens, inflammatory events, but basically anything that's going to happen to our body right now at any given moment. And so the platelets travel down to the spleen, where our spleen takes about a third of our larger platelets and keeps them just on reserve, kind of like military reserve. They're on call when needed. And so bone marrow, lungs to the spleen. So our body is making these things and putting them around the body, so at any given moment they can be deployed. So like I said, the main thing I want you to take away is that depending on what's going to happen to you, even as you're sitting here listening to this call, your platelets are doing activity, and depending on what's happening to you, the turnover rate can change. The number during that minute can change. What the sizes, the amount of larger platelets compared to small ones in the bloodstream will change. And then what the platelet is actually carrying on itself, whether it's weapons or repair, can change. So really our platelets are actually responding to human disease state. That's what they're doing. So what do? Well, one of my favorite papers talks about platelets being synonymous to drones, because drones are constantly surveilling the bloodstream looking for two things. That's threats and repair needs. And so when they encounter either one, the platelet has different types of things on its surface to know what's happening. For example, let's talk about repair needs. Our platelets actually carry around 95% of our body's serotonin. So if you think about that, it doesn't make that hormone, but it's carrying around almost the entire bulk of the body's need. Why? Well, if you have any type of liver condition, if you need help detoxing, serotonin is one thing you definitely need. What about this one? Brain-derived neurotrophic factor. Our platelets carry 99% of this growth factor. Why do you need that? Well, if you have Parkinson's, dementia, Alzheimer's, cerebral palsy, diabetic neuropathy, anything that's neurological, you're going to need this, and the platelets carry it. And this is not all that it carries, but I'm just giving you a couple of just snapshots to help you appreciate that it's carrying around a lot of stuff. What about receptors? So when our cells get injured, they throw out these like status reports in the bloodstream to say, hey, this is if I was to get into a car wreck and get injured, the cells in that particular organ, let's call it my brain, would throw out these status reports into the bloodstream to say, hey, I sustained injury. This is the extent of it. This is what I need, because I'm going to shut down communication right now. Please help me. Well, guess what? Guess who has the receptors who's picking up all of these little messages in a bottle in the bloodstream? It's your platelets. So your platelets have, when your cells get hurt, and if you have a disease condition, that means they're hurt. Your platelets are the ones who are carrying around all the stuff that it needs to help fix them. But what about like for immune response? So the things I want to concentrate here are pathogen recognition, pattern recognition. Whoops, sorry. And what are those? Well, if you have any type of virus, mold, bacteria, fungus, how does your body know? Your body responds differently to a mold than it does a bacteria. What it deploys and what it uses as weapons will be different for each different pathogen. Well, guess who's the one thing determining what is what? Your platelets determining pathogen recognition. Are you a mold or are you a virus? Are you an Epstein-Barr virus? Are you a herpes virus? Are you a bacteria? Are you Bartonella? What about pattern recognition? Pattern is really what are you trying to do to me? How are you trying to beat my body? How are you trying to beat my defenses? Because the flu virus from last season is going to be the same flu virus from this season, except a different strain. But so it's different. But the platelet can recognize, oh, you're the same virus, but you're running, but the patterns of what you are, and how you're trying to beat our defenses. I've seen this before because you're following a pattern. So, to give you an example of what I'm talking about, this is a graphic to show you just of some of the virus families of the different receptors that the platelet has on it. So a platelet is constantly heat seeking out and looking for Epstein-Barr virus, HIV virus, Coxsackie, rotavirus, cytomegalovirus. It's actively looking for these things. So I could make an argument. I always say that, based on what I'm looking at right here, I would use this as the new vaccine schedule. Just take this out of my body and reset it. reset what my body can see so it can be able to determine, oh, you're an Epstein-Barr virus, you're a cytomegalovirus. Why use a vaccine when I can use my own body's intelligence? Um, and so to understand as we get towards the end of this, how it's going to potentially help you, you first need to understand what inflammation is. And what inflammation is is this is our repair. This is a graphic to illustrate our repair system and our immune system. And what this is meant to show is that our repair system goes through a sequential order of events. If you can see my cursor, from this event to this event to step 3 to step 4 and so on, in how we repair and heal everything. So at each step, the body makes sure that certain things are satisfied and kind of checked before it will let it go on to the next step. And the immune system works the same way. It's a series of stage gates and checks and balances because the body is very regimented. But most of us get stuck at a particular event for one reason or another, which is not really it's beyond the scope of this call. But most of us get stuck right here at step 2 in this inflammatory feedback loop. And so what this means is that most of us get stuck right here because we don't have the material, the information that the body will let us go on to the next step. And so it says, I'm going to keep you here until you give me what I need. And so this feedback loop of inflammation for this particular injury, you'll be stuck in, until your body gets what it needs. And the same thing can happen for the immune system. Let's say if you're trying to clear out a virus. And what happens is you take an individual singular event and these unresolved repairs or immune clearances will start to stack on top of one another. And they'll start out as simple inflammatory type conditions, kind of like inflammatory, Hashimoto's and thyroid. But they'll start to stack on one another, let's say over a lifetime or a series of years, and they'll advance from inflammatory conditions to now you're into more aggressive peripheral related things that are going to impact your vascular system. Kind of like Raynaud's disease or sexual dysfunction, inflammatory hair loss, diabetic neuropathy, macular degeneration. And if those don't get, cancer is in this category too, right here. But if they don't get resolved and they keep stacking, you'll keep declining and declining until you get right here. Right about this point right here looks about like cognitive dysfunction, fatigue, fine motor loss, because you're very close to getting to chronic neurological, where it's, this is where you have your Parkinson's, your dementia, your autism, your Lyme disease. This is where you have a chronic neurologically impacting disease condition. So really inflammation is a body's, experiencing these unresolved repairs and these unresolved immune issues. And along the way, your body learns to coexist with these unresolved repairs. And as it coexists and learns to kind of deal with the problems and create workarounds to keep the body functioning, your body has to now has been forced to prioritize, well, what's important? Because it starts turning off different cell functions that aren't optimally working efficiently. Or if the thyroid isn't working efficiently, the body will just simply shut it down because it has to divert those resources to other organs. Kind of like pruning a peach tree. I learned that when I was about a decade ago when I had peach trees in my backyard. I learned that you had to prune off the small fruit so it would give the nutrients and everything to the bigger fruit. This is the same thing. So, okay, here we are. How is this treatment going to reverse it? And I'm going to give you 4 ways and reasons and how scientifically this is reversing it. So when I take blood out of your body is immediately replacing what it just lost. So, and remember, I told you that the platelets are being manufactured at about 70 million per minute. So the time that I take blood out of your body, let's just call it 100 mils of blood, the volume of platelets that were lost in that 100 mils are now being repopulated. immediately. So your rate turnover has changed based on that event. And 30 minutes later, while you're sitting in the chair waiting for the process and waiting for your treatment, your body's already replenished that amount that you lost. And now you get this concentrated dose of platelets back in the therapy. So now you have basically your body has already got what it lost. And now you have this dose specific therapy and all those excess platelets, your body says, hey, how about you get to work and go start fixing this and that? The second way has to do with, proportions and ratios. And what I mean by that is that even going back to the Greeks, they saw that the difference between health and disease or pain was the body's ability to maintain ratios of certain things in the body to one another. And what I'm talking about with regards to proportions and ratios have to deal with the hemodynamics of your bloodstream. And I mean, you have your platelets in the bloodstream, but you also have let's just say your white blood cells and your red blood cells. And so a ratio means, let's just pretend that there's 20 platelets in my bloodstream to every one white blood cell to every 10 red blood cells. I'm just making something up. So my body's equilibrium or homeostasis is being maintained right now by a ratio of 20 to 1 to 10 of these three cell populations. But now let's expand it to everything in your bloodstream. And guess who's the one thing that actually manages the ratios of everything to one another and is constantly calibrating the ratios of everything to one another? That would be your platelets. So if I give back a super dose concentration of your platelets, that's going to cause the ratios in every cell and hormone in your bloodstream to immediately recalibrate and change. And I know that because we've taken tons of blood data from people right before the treatment and just a few days later, and their blood will change dramatically. So the hemodynamic ratios are changed because your platelets are the ones responsible overseeing the ratios of everything to one another. The third reason is because when I take these platelets out of your body and they are responsible, I forgot to say this, your platelets are the one thing that's responsible for actually initiating our body's repair system and immune system to begin. So that series of that circular graphic that I showed you, your platelets actually responsible for overseeing that and activating both of those. But during coexistence, and you have these, chronic problems, your platelets doing everything it can to maintain balance. And so, but when I take that out of your bloodstream and it's now not being stimulated by anything, there's no information being sent to it. It's sitting over here in these syringes or in this blood bag, waiting to be processed in the centrifuge. Well, the moment that I put it back into your body, that entire information that it hadn't seen is now reset. It's like it's seeing everything for the first time again. And the technical term for that is referred to as immune and repair recognition. It's all reset. So your body says there's no more coexistence because now I'm able to determine what's important. What's the most important organ I should get to for this person right now? I can tell you that everybody's going to experience, for the most part, your brain, heart, and lungs, because those out of all the organ systems are the three most important. But the fourth one, I'll get to in a minute, could be the thyroid, and it could be for one person, but it could be the pancreas for another person. It just depends on how their body chose to turn them off. But as the platelets go in there and are fixing things, and this information is reset, it now knows, oh, this is what you needed this whole time. So let me give this to you so you can exit out of this feedback loop right here at step 2. Let me give you this right here so I can kill this virus so you can go ahead and complete that repair cycle that you failed to complete, 10 years ago, maybe 30 years ago. Or let me get this virus out of you, like the herpes virus, for example, that's been in you since, for the past 30 years. Let's get that out of your bloodstream. So there's no more coexistence. And again, your head, heart, lungs are typically what's repaired first. But for the fourth and fifth and the sixth organ is going to be dependent on that person. I can tell you that everybody walks into an office with joint pain, almost everybody. But I can tell you on the 12 organ systems, joints are second to last as far as importance, right above skin. So if you've got joint pain, what I'm telling you is that it's already made its way through the body. And if you have joint pain, then that means that you have problems upstream with other organ systems. The last thing is, and then we're done, is it's regard to the genetic material within the platelet, because I talked about health and ratios and different repair packages, but they now have better technology, and they determined that there's about 2,500 proteins and molecules within the genetic material of a platelet that they never knew were there, that are all related to health and disease. And when I speak of this, what I'm talking about is epigenetics. And if anybody doesn't know what epigenetics are, it's how our health and our genetics are altered from the food we eat, the medications we take, and the environment we live in. And what I mean is that I'm not as healthy genetically as my great great grandfather, nor my dad, and my son is not as healthy as I am, and that will continue. But because platelets are anucleated cells, and they are the potential for them to be hijacked by any type of pathogen or virus is not likely, that this genetic material is essentially code that's been passed down from my healthy grandfather to my dad to me. So when I do this treatment and I give this back to me, it's essentially, this is theoretical now, it's essentially kind of like doing a software update to my body little by little to the cells in my body. The genetic material within my platelet is being handed off to these cells that have been altered by the foods and the medications, and saying, here's a piece of code to rechange your genetic material back, very much like a software update. Um, and if you keep doing this, and we know this to be somewhat true, because we do have some epigenetic blood data, and see these people change. So to summarize it, the TruDose therapy is a therapy from your blood. It's utilizing your own platelets. It's relying on the intelligence that basically you were born with and given with, to reset and restart your immune system and your repair system to help you exit out of these inflammatory feedback loops. And as you're doing this, you're going to start alleviating symptoms to help you reverse from these conditions. So I'll stop right there and open it up, Dr. Breiner.
That's great. Wow. We guys got a lot of good information. It's is obviously that was a little heavy on the science, but some people really like that. They want to be able to learn. And you may not understand every bit of it, but I think, the take home is it's, your body, but better, right? That's really, I think, what's happening is, we're helping reset or control, alt delete on the little spinny wheel that may be your processing systems that have gotten stuck, and you're allowing it to kind of reboot, do the software updates, right? You're saying you're getting the original code, the genetic information, if I'm following you correctly, Tapley, and the cells can start resetting. We have this whole idea of the hemodynamics, right? Everything was in a ratio. You just gave it more platelets. Now it's got to raise your white blood cells, and it's got to reset everything. So that's awesome. Um, so I know we got questions, so we can probably talk on and on about different things here. I know there was one question here about neuropathy at the beginning. Can you speak a little bit about neuropathy?
Oh my gosh, I just gave you that example at the beginning about the little girl with um, with cerebral palsy, or diabetic neuropathy, or chemo-induced neuropathy, or really any type of sensory related thing. Again, I would say these patients respond very quickly. That's very common, and when I say quickly, I mean with sometimes before they even walk out of the door. So the neuropathy effects of it is profound. The neurological effects of this treatment is profound.
Yeah, we've seen some of that too. I just saw this little quick thing about FDA approved. All platelet PRP therapies are FDA approved or cleared. It's not FDA. I guess each condition has to have its own like FDA if it's a drug, but their platelets aren't a drug, so they don't require FDA approval.
Yeah, the FDA has really ruled on this ever since the 21st Century Cures Act, and they kind of gave a time to let doctors and scientists and the medical community figure out if there's any advancement within regenerative therapies. And it took about 2 or 3 years. COVID shut it down, but they've ruled on this. And it goes something like this. You can do, regenerative therapies. Blood related therapies are outside of the scope of what the FDA considers its oversight, if you will, because the efficacy and the safety of it is well established. But if you're talking stem cell therapies and going, to Taiwan and to Panama, that's a different story. But things from your blood it's well established. There's nothing that the FDA there's nothing that has to be cleared because it's using your own body.
Right. Otherwise, well, I guess sometimes the drug companies do want to approve everything that happens to you. But yeah, they don't have to approve you yourself. And I know that there was a question, actually, this can help us out a little bit about the neuropathy. It was a mold-induced exposure neuropathy. And I know Elena, you're on the call here, and Elena had mold as part of her background. So I'll let the two of you kind of maybe answer that a little bit as well about molds and infectious disease and what that can, what that means with TruDose.
Elena, do you mind? I often ask, her name's Elena, to jump on these calls because, I've been in face front with several thousand people with chronic diseases, but I've never lived a life with mold or Lyme disease. But so I often ask, her name's Elena. Elena, there's a question about mold. Can you share your quick story and maybe this might be a good segue into you?
Sure. So after going through extensive Lyme treatment, 25 years after being exposed to it, I ended up with mold illness. I lost the entire content of my house to a bad remediation. And I found that everywhere I went, I would react within 15 minutes. Now, I've been doing TruDose for about 1.5 years. I do regular treatments about every 8 to 12 weeks. And I find that the mold doesn't affect me nearly like it did before. After many exposures, I do sometimes get the cognitive. I'll go in, have a treatment, and everything, all my symptoms are put to rest, so to speak. I'm just about ready to have all my levels retested to see, but I don't think it's held in my system like it was before. Do you have specific questions? I mean, I have a laundry list of things that I've kind of overcome with TruDose: Lyme's disease for over 25 years, systemic mast cell disease, something called MOG that affects my central nervous system and optic nerve, POT syndrome, Hashimoto's. I should have a cheat sheet. And everything for me has really reversed itself. I've got some blood work at the antibody levels, all my viruses. I had all the herpes, co-infections, Epstein-Barr. That is all no longer in my bloodstream, which is was super fascinating for me. And that's kind of it. It really, it saved my life. Essentially, I had been in bed for about 5 years. And so now I'm fully functioning. energy's back, working, and that's kind of it. You have specifics for me tonight, Chop?
Maybe, maybe I know there will be. So maybe if you don't mind, if I can jump back to you when I
Yeah.
can. You know,
Yeah.
oh,
I think one of the questions I saw as people are typing these in is about how many treatments it takes. And Tapley, I know you can talk about that. I mean, Elena, you can also speak to when you started seeing improvements and, you know,
Mhm.
how long it took for you to kind of reach a level of feeling pretty freaking awesome compared to, you know, bedridden.
For me, I had great success after my first treatment. My second treatment, I did herx for quite some time. But for when my herx was, it was more fatigue and exhaustion that set back in. And right about then, let's see, I guess it was at the 8-week mark, I had my third treatment, and I had a flare of my MOG, which typically would send me to bed for about 6 months at a time. And within 24 hours, all my symptoms kind of evaporated, if you will. I'm not quite sure the right word to use for that. And, you know, I do still do them every 8 to 12 weeks, but being that it's changed my life so dramatically, and I still have reactions. My last treatment was a doozy, and I did herx for about 48 hours. And, you know, I didn't do that treatment. I hadn't done anything prior. I didn't do vitamin C IVs. Wasn't on ivermectin. I didn't do any of the stuff I typically do. So they still affect me a year and a half later. And, but once it's done, I'm back on my feet and ready to go. So, you know, my system, I think, is still clearing some of this stuff out.
Right, right.
And you know, we're exposed to everything on the daily basis. So
Absolutely. I mean, I know some questions are like, what do people do for you answer how long your herx lasts for, Tapley. I think typically what people, after they're getting their session, they may feel like we'll call it a healing crisis or herxing, you know, typically how long after that treatment, if they're going to have it, and then for how long will that last?
I mean, it can vary. It could not happen. It could happen for a couple of days. It could be like Elena, but but each successive treatment, as the body starts to heal itself and it gets under control, the likelihood of that herxing diminishes, right? Because you're clearing stuff out, and there's herxing is basically getting rid of all the trash and the toxins in your body, essentially. And as you're, you know, if someone's really sick, you know, it might have to expend a lot of its energy doing a lot of trash cleanup and less repair. But by doing just trash cleanup, that's you're gonna feel world's difference as well. You know, like the question is talking about neuropathy related to mold. I mean, I can show you here. I'll just, you know, I'll do it in a second, but I'll show you blood data where this that we've collected, that this gets mold out of your bloodstream. And maybe Dr. Breiner, as I'm pulling that, maybe you can go to the next couple of questions.
Yeah, I think some of the questions also about like how do you minimize the herxing, and you know we have different tools in our tool chests with different, you know, botanicals, homeopathics, you know, some therapies that we have obviously to help minimize herxing. I mean, we're going to make sure that your lymphatics are moving, your liver supported, your bowels are moving, and some people might need colonics, some people, um, you know, doing even at home like some Epsom salt baths, sauna, you know, different things just kind of help your body through as we give you some things to, you know, aid that process. And I guess in preparation for the TruDose, you know, we may be having you do some things. Lena, you just alluded to like, you know, ivermectin, vitamin C, and some other things. So that sometimes will be part of the protocol for you pre-TruDose in order to kind of get some of those bacteria and viruses dealt with, or I guess exposed, right, Tapley? I guess that's the best way. So you're to describe it. So those drones that are really coming in on, on a full blitzkrieg can come in and see them really well to get the immune system to go after it. So there's different things, different approaches depending on the case, right?
Right, right. You're not going to treat somebody with, that now that you're not going to treat somebody with PANS or PANDAS the same way you're going to treat somebody with cerebral palsy, the prep protocol. But now that somebody's asking a question about, I just saw it. Well, here, let me just, if you don't mind me,
Go ahead, give us that example on the mold there.
well, it's pulling up. There's a question about here. How does the software determine dose? The same condition. Um, it's not really that. If you have a lot of things going on with you, then then that means there's a lot of lights on the dashboard. Where do you start? You're gonna obviously you're gonna have to give something, because the software is not going to tell you what you have. Although I can look on the back end and I can pretty much tell you what you probably have and where you're going. But the software is not going to be able to tell you without even looking at you what you have. You're going to have to tell it, hey, this is what I'm experiencing. This is what I have. And that's a place to start. So if you have mold and, I don't know, TBI, you're going to have to, pick one of those and start there, if that makes sense.
Right. So I think people also trying to contemplate or visualize what's happening. You come into the office, um, you already have had like an intake with, let's say, Dr. Johnston, who's on the line here with us, who said, okay, I know what you're coming in for TruDose, and he may prescribe certain things for prep. I may suggest some things as well. You're coming into the office, then you're getting your finger prick at the time a day, and we're saying, okay, so what are we trying to treat here, right? Is it TBI? Is it mold? Is it Lyme? Um, is it a knee or hair or whatever it is? That then goes and a special platelet counter gets read, and that's attached to your software and algorithms and everything that you developed. Or I think someone asked, well, if you're not a software engineer, how did you do that? But I guess people could write the code, right? Tapley came up with
Yeah, I
formula.
did. I just told some people to say, hey, I need you to write software code. When it comes time to the intelligence, I'll take that over, because the algorithms and the intelligence, that's what was downloaded to me.
Right.
So how the software was built and how it executes is really a mute point. It's really what it's figuring out. That's what the key that I had.
So it figures out, it says, okay, you who have a mold issue, we're trying to have the platelets work on the mold. It's going to say, okay, in order to do that, you have to have a platelet concentration in, X range. It's got to be at least at this level. And in order to achieve that in you today, we have to draw 125 cc's of blood and then get it concentrated down. And then one of the things also that's done is that um, that a sample of that PRP is actually taken and reanalyzed to make sure it actually was the right dose, so that you actually got that therapeutic dose. And then it goes back into administration, whether it's a local injection or systemic.
That's right. So I mean,
That's pretty much it, right? That's the procedure.
essentially, that's it. It's very, I I guess people are underwhelmed by maybe the process of it, and maybe they're for what it does. They're thinking that it's more of a, there must be more to it as far as during the actual treatment itself. And it's kind of funny because it's like, nope, that's it. There's no robots, there's no lasers, there's no tumbling act, but the effects of it are real.
Right.
Um,
Yeah, and I think actually is a good time to bring that up and saying, well, how quickly do people see the effects? You were talking about the cerebral palsy, the spasticity, that kind of releasing quickly, but there's also this whole emotional component, which I thought always found very fascinating. Um, you know, we've seen some people have it, some people don't, right? And Tapley, I guess Elena, you could talk about it as well, right? You've seen tons of people going through the shift, as you guys have coined it. Describe the shift. Describe the cognitive emotional changes that can happen to people, even shortly after their reinfusion and then down the line. What are you guys seeing from it, from a mental aspect, emotional aspect?
You know, when you look at the when you have a chronic disease, the autonomic nervous system is in this state of flight or flight. And what that means is, from an emotional standpoint, that you're in this disconnected, non-empathetic, not grounded, depressed, hopelessness. It's already gone past rage and anger. You're already into despair. And that is essentially, you have to remove, especially if there's emotional trauma, PTSD. I mean, that's how we get things like bipolar or schizophrenia or depression. On the chart, it's not a predisposition for those. Those depression, schizophrenia are acquired. They are acquired. So, and what he's talking about, the shift is that it commonly happens to people that have experienced, like, again, PTSD, and just insert the blank on whatever that is. It could have been something that happened to you in your childhood, because your brain protects you from those events, but that event is still there. And what we see happen is that you see this emotional release, this shift from, well, Lena, can you describe what the from a patient standpoint, what the emotional release is?
Right. So, what happened to me after my first treatment was I had this sense of happy that had come over me, and it was to my core. And I've had a hard time really describing it and putting my finger on it, other than I could refer to it as that. The more treatments I had, the better I became cognitively. Everything kind of came back to me as well. This sense in my core never went away. And now I truly believe it's the body's recognizing hope for the first time. Because I had been sick for so many decades, and it was like this shift that happened. And then about, I guess it was just a couple months ago, I was driving and I did pull over, because it was this realization that this treatment is such a mind, body, spirit healing. And the hope had shifted into faith, and it was a faith that I hadn't experienced before. And it was, me driving in my car. It wasn't about anything other than the fact that my body had healed in such a profound way that all I could do was turn this over. And so it's this core level of emotion that just shifts. And that's how I can describe it.
Dr. Breiner, I'm gonna blaze through some of these questions. I just realized some of them are directly directed to me. And so
Yeah, go ahead. Answer some of them.
So there's a question about TruDose and Parkinson's. Treated tons of Parkinson's. I can tell you that that they're afflect. They're they go from a state of just being robotic to they kind of come alive. That could happen within the first, that's an emotional shift we're talking about. That we could happen within the first 24 hours, up to about 10 days. You'll start to see these little changes happening to them. I don't know how to say it. They kind of snap out of this locked state. They'll start remembering things. They'll start doing things they haven't done in a long time. Re-engaging back into family. They come alive. Treated lots of them. It helps. It's one of those conditions where you're going to need multiple treatments. There's a question about if someone's on monoclonal antibodies and has had has a long, I mean, if you've had them, it's not going to interfere with it. But if you're doing it simultaneously, I'm not a doctor. Don't take my advice. I can tell you it's probably going to counteract the effects. So if it's in your system, half-life, regardless, you'll be okay. But if you're gonna like do it this one day and then do this 2 days later or a week later, I probably wouldn't recommend doing it. There's a question about, are there any ingredients that are added? No, it's just your own blood. It's just your own blood. Nothing's added. So there's nothing special. There's no, how many treatments do people typically get? So here's how to determine how many you think you might need. The easiest way is to just take a self-reflection and say, do I sleep? And I mean, do I sleep into deep, sound sleep? Because if you don't sleep very well, that's code for systemic problem. You may have joint pain. So if you have joint pain and you sleep well, then it's probably just joint pain. So you would get probably a site-specific injection, probably. But if you have more than one joint that hurts, that's systemic. If you don't sleep, that's systemic. If you have something that's neurological in that category 3, then to get you back from category 3 up to category 2, up to category 1 and reversal, you're going to need multiple treatments every 8 to 12 weeks. I would discourage anybody from doing just one if you're in that category. I would say that 4 is really the starting point, because that's going to get your body and your mind and your emotional state to a place it hasn't been to in years. And what people typically do is they are able to self-assess at that point. And what people typically do is they continue the 8 to 12 week regimen simply because it's cheaper to do this treatment, and it's getting them healthier, and it's getting them off supplements, it's getting them off medications, and because their body's working again. I mean, Elena, don't you? You still,
Yeah.
you still. I mean, I still do this I do this every 8 to 12 weeks, and there's nothing wrong with me, but I still have to deal with life stressors, emotions, kids, job stress, and I still have to live on planet Earth.
Yeah,
Elena?
Lena, what do you have to say?
Well, for me, I was taking literally 50 supplements a day. And it was when I started doing my budget, I was spending about close to $5,000 a month just on trying to maintain some kind of normal. I still was isolated. I still had to cancel everything. But my supplement bill was about $1,400 a month. And I still don't know how my body assimilated, 50 different things. Now I take 3.
Yeah, I think that just because some people ask the question, the fees, the TruDose treatment is 1,800. That we do have packaging. We always tell people, do one so and then we can package the other 3. And of course, you do have to go and get a just an intake clearance. Dr. Johnson's here. He can tell you what that's like if you have questions. But since Dr. Johnson's on the line and he got to experience TruDose.
I was gonna say, I was gonna ask, hey,
Yeah, sure. Can you guys hear
Why
me?
don't you tell us what happened with you? Because it's
Yeah.
nothing like firsthand experience. If the doctor
Yeah,
does,
no,
that's
I'm
gotta be
happy to
good.
share my experience. So I've only done one back in December, and I've got a few chronic health challenges I'm dealing with, some Lyme, some mold exposure, some cognitive. Actually, there's quite a few things. So after the first infusion, I would say that I had this profound sense of calm come over my body, probably unlike anything I've experienced before. It must have lasted at least a half an hour. And I would say I was very tired the next couple of days, the following week. So I guess I was detoxing and things were working, cellular repair. And my sleep started to get much deeper. My sleep's never been that great, especially the last few years. I wake up a lot, and I started to sleep much deeper and feel like more well rested when I would wake up. Also, I noticed my my moods were better. They were more even. And I was having better mental clarity and energy, even after the first one. And so I'm looking forward to continuing and seeing what else can come in store for me. So
We got a t-shirt coming for you.
Yeah.
oh, good. I'll wear it.
The,
That's great. That's great. Yeah, I think also some people are saying, well, what about like just peak performance, right? Like just somebody who's like yourself, Tapley, who is not uh super sick or doesn't have a lot of health challenges, and you're saying how, it kind of helps you do better. But I think you've had, athletes, the weekend warriors, the executives who just want to take things to the next level, right? The biohacker people. I mean, uh,
I mean,
what have we been seeing with that?
I mean, like I said, our jobs are incredibly complex and complicated compared to a decade ago. And um, I do this because I don't get sick, and I'm continuously on my game. We've done this to people that as far as performance related, I've done it to major league umpires who are constantly scored against, artificial intelligence cameras every night. You know, guys that are getting, they having a hard time calling balls and strikes, and a month later he's beating the AI. So your your focus and your clarity and your ability to do it day in and day out is probably what I'm trying to say, is because your body is just at peak optimum. So if you know, and that's what patients kind of get to is I can take an approach where I've constantly been in this fight or flight, and now I'm at a place where I haven't been to in a while. I don't want to go back there, and that becomes preventative. That's what I do. It sounds like that's what Elena does. Um, and then I mean, we don't have to go into that story, but you actually did some brain
Yeah,
stuff on
yeah,
me.
right. Because you had a past history of attention deficit, right? Right. You're medicated, I guess.
Right. And you saw
You don't medicate anymore, right? So TruDose. Now, we don't have a brain EEG, brain mapping, ERP studies of your brain before TruDose, so we can't really say. But I decided, like, okay, Tapley had ADD. Let me see if his brain really looks like an ADD brain anymore, uh, and it doesn't. I'll tell you that we something do called evoke response potential testing, which is a way of seeing your brain under task to literally how when you see a like a go or no go or hear a sound, how quickly you can respond on the computer and actually watch what the brain does when that's happening. Uh, a good sort of average response time would be 600 milliseconds, or a little faster is even great too. And if you don't have variation, right, so your brain is really able to do it. Tapley, he's the fastest we've ever clocked in our system. He's under 400 milliseconds, like 383, and it with almost no variation. He's going to try and beat it with another few infusions, I think. But so it's doing something. It's got to be doing something for your brain, and with the brain-derived neurotropic factor, BDNF, and all the other great stuff TruDose can do. So I don't know. It's pretty impressive.
there's a question here about pans and pandas, and I'm going to share this. I had to. Can you see this?
Yep, there you go.
This is one of the first ones I treated in pans and pandas. If you don't know what it is, this is for someone specifically asking this in the chat. Treated lots of these. There's a prep protocol. Dr. Breiner has it. It's 2 or 3, 4 days of prep and then the TruDose treatment. But this was one of our first, and this is something that I don't know how this girl was. I mean, her mom brought her in here, and she was on IVIG. They'd been everywhere, and she let me listen to. She was on iTunes. She was a country singer. It's like, oh my gosh! But this is what she looked like when she walked in the door. Um, you know, this was her 3 days later. And I don't have the, you can just see in her face, but she went from basically, um, someone who was, it was very uncomfortable to watch the state that she was in, to one treatment. She was engaging with the family. I mean, it just turned her entire life around. Um, Now that this was the early on, I didn't know about, how many treatments and frequency. Um, so, but now we know that, and we have videos that you can go onto our website and hear doctors talk about their experience with PANS and PANDAS, but it has a tremendous effect on these kids.
It's a neuroinflammation. You say people asking, what is pandas? So, uh, so it's you can define it if you want to put Tapley, but it's either from some infection or typically strep, but other things that's got a neuroinflammation. So it's difficult to for a lot of these families and the kids going through it.
And I think this is because there's a lot of questions here talking about, detoxing and minimizing herpes. I guess the thing is that with this treatment, this is going to detox you, in my opinion, better than anything that you could. It's going to find the things that are trying to hide from the immune defense.
Mhm.
You know, and that's kind of like the first treatment. It's probably going to cause a mild herpes because it's going to get a lot of stuff that's in the bloodstream. And I always say it's gonna just get the stuff on top of the ant pile. The second treatment, it's going to take a big scoop out of the dirt, and there's just no way around it. Um, especially with kids and PANS and PANDAS and Lyme and pathogens and parasites, you're going to see this stuff come out. And uh, so, you know, it's not this prolonged herxing for weeks on end. It's your body. It looks something like this. There's days of good, there's days of bad, there's days of good, days of bad. It's like this sine wave. And the next treatment, the sine wave is not as profound. The third treatment, it's more flattened. And as you do more and more treatments, it's more like this. So you can't really distinguish the good days and bad days because your body is just healing, repairing at the same rate. Whereas before, it's like this healing, getting trash out, healing, detoxing. And that's the stress and the healing crisis that Dr. Breiner was talking about.
Right. But the general trend is up, I think what you're trying to say. So
The general trend is up, but
right.
on the way up, it looks kind of like this, depending on what condition you have.
Well,
For
like
say,
Dr. Johnson, like you also probably been experiencing that, right? Like days where you feel pretty freaking awesome, other days where you're kind of
Yeah, definitely.
I
And
think we've seen that with our patients that are reporting back. Um,
mhm.
they've had their great days and not so great days, but they all noted like, oh yeah, I feel a change. Like it's
It's definitely an up and down process, but the good days are getting better. So
that's
but
awesome.
but but for people with like cerebral palsy or neuropathy, they might not have to go through that because um, it just depends on what the underlying causation is. Like the girl I talked about last week in Chicago, she had cerebral palsy, didn't have toxins, didn't have a lot of parasites, didn't have a lot of, there's no concern of PANS and PANDAS.
Mhm.
Um, she didn't experience any herxing. There's a likelihood she will not experience because she has a different causation.
Right. And then like there's like the learning disabilities. We had my nephew Caleb came in and he did a session. He had some issues of like reading and certain concentrations, some behavioral things that he got tremendously better was doing our neurotherapies on him. And I said, hey, let's have him do this. So he came in, he did his TruDose treatment, and uh, my brother was saying by that night he was already starting to shift, or he was doing things on his own, was starting to not need the extra help, and by that next day and over the next week his teachers are like, what's going on here? They're like,
yeah,
it's changed. I mean, he's reading better, he's engaging, he's actually, you could tell he's like more mature, and just like it's pretty amazing. And he did not have that sort of detox Herx type of reaction because maybe his body was, it just needed something else to be reset, right? Like I think you had that graph before where you showed like autism on like that furthest off stage, or some of the learning disabilities, dyslexia, and all those other things, right? So they had some insult that just took them all the way over to that.
Right.
And it can kind of reverse some of that fairly quickly for some of the kids, right?
Yes. I mean, especially, I mean, I'm glad you asked kids because before I get into PTSD, there's some questions, but this has a profound uh, benefit to kids. They, especially neurological, just in, dyslexia. Uh, I treat my kids. I can tell you, I have yet to come across a kid who does not have the best academic semester they've ever had. Their reading comprehension, when kids or bodies are, I'm not a doctor, but I've now come to see that kids' bodies are designed to thrive. But when they're dealing with insults, they can't. And so when you remove those, what happens? They shoot up like weeds, and their mind is able to absorb things. And like you said, it looks like maturing, but it's more like assimilation. It's more like their social acuity heightens. So especially autism, it um, happens all the time. Kids who are nonverbal very quickly, even within the first 24 hours, become verbal. They start to become emotionally connected. The fine motor skills come back. Um, simple tasks turn into complex tasks they can perform. So the neurological effects for kids, especially kids that have to deal with the world we live in today, there's no way to say it. They're simply profound.
Hmm.
Um,
Yeah, I think your daughter had dyslexia, right?
oh my daughter had this. She was patient number two, and this is before I had any idea what was going on. I said, "Hey, she's got a chronic ankle injury. I'm tired of dealing with it." I took her to a friend of mine. He injected her ankle. There was only a little bit he could inject into her, which it healed her ankle. But I said, inject the rest into her intravenously, which she did. He did. And long story short, 2 months later, when school started, my daughter's borderline dyslexic, very good at math, very, I don't know, artsy brain, and disorganized, very disheveled, papers in the backpack. I started like within the first week of school, she asked me to get something out of her backpack to sign, and I reached in there and everything was filed and color coded and assembled. It was neat. Yeah, it was, with tabs, like in her handwriting, it looked like somebody had written calligraphy. I called my wife in there. I said, "Look at this." It didn't even look like our daughter. Then we're getting things home from school that she needs to be tested for the gifted and talented program. She had gone from below reading level at the Texas level to mastery. That's happened to my fourth child now as well. So, you know, now I just get my kids treated. It's like,
Yeah.
I'll go into McDonald's.
You know, one of the things that reminds me about another thing that TruDose seems to affect is the hormones, and also the because it because there's like hormones, right? Just part of in the receptors and the chemokines and cytokines and stuff in the platelets themselves, and you're kind of resetting, right? That whole hemodynamics you're just talking about before, um, and how you mentioned about like thyroid, but uh, like a lot of people, I think after TruDose, right, the kids will start growing, the growth hormone will be more optimized, but that's not just with kids, that's also with adults as well. And I know you've told stories about like people's like libidos like going like freaking crazy, and that's not even doing PRP in the private spots, which TruDose for that will be great too, but just the hormones, right? The hormones, the whole body's hormones just start balancing.
It's that whole calibration in the bloodstream, the hemodynamics. It's the people's thyroids go from not working to working. The it's I'll just throw this out there. Dr. Johnson, I remember there's a patient we treated in Lincoln. She was her husband was she had contacted us through our website and said, I need you to introduce this to my doctor. I've been everywhere. And when I finally got there, we were treating a series of patients, and she comes in. She was, I think, 50 or 51. She looked like she was walking like she was 90 on oxygen. She had a hemoglobin of 4.
Wow.
Is that bad?
That's really bad. That's low. That's
Her
You're not going to
husband,
be walking around with a hemoglobin of 4 too much.
she had a treatment that day. They did her blood results 7 days later, and it went from 4 to 11.
Wow.
Wow, that's incredible.
And there's a
So,
whole now I have her blood results, after she's gotten now 2 or 3 treatments, and everything that was abnormal, which is basically everything in the bloodstream, has now, there's nothing abnormal. And I guess kind of like the one thing that people had to really point out to her, I mean, she had gone from, her husband was preparing for hospice after the first treatment. She talked about, well, yeah, I think it's working. I did a mile walk yesterday, and I did, like, whoa. So we literally had to drive. I drove myself to the mall. It's like, I'm eating this and that again. So you literally had to, she had been in such
yeah,
a state of chronic health that she didn't really realize that she was completing these tasks that were insurmountable.
yeah,
Right.
that's incredible.
That's amazing. You know, I
Um,
someone actually had
there's a question about complications or contraindications and treatment success. Um, Complications, you know, there's none that's been reported. Um, yeah, there's nothing. I mean, if I definitely would have heard about it by now. Um, um, and out of the close to 10,000 patients, what's the treatment success rate? It depends. It depends on the specific condition, and it also depends on what people consider success. For 2 people with fibromyalgia, I say this all the time. One person just wants to get out of bed. The other person wants to beat it completely and get it out of their bloodstream and reverse their condition back to when they were 30. So those 2 people have different types of barometers of what they consider successful. But um, I would say, I would say, uh, I would answer this without having to, pull out a bunch of data and say, this is the percent rate on this condition, this is on this condition. I would say overall, um, that your neurological conditions have a very high success rate. Your even a lot of your chronic diseases, those are really high. I would say it's rare that nobody experiences anything positive from a single treatment, even the first treatment. I would say that's rare. And if you continue to do it, I mean, we have patient after patient, video after video, that if you keep doing this, you will reverse it. Your blood will look different. Your metabolic data will look different. Your brain will look different. It will operate differently.
I think one of the questions that was about, if they're treating all these different things and they have ADD or ADHD, and as an adult, will I lose the upside of getting, um, you know, treating the ADHD? I get that question sometimes when you have, we're doing, brain specific neurotherapies and stuff. Like if I treat my whatever, my attention or whatever, am I going to lose my creativity side? Am I not going to be able to do music or art or whatever? Um, no, you can't. I think one of the things that misnomers about like ADD or ADHD is like usually these people are quite intelligent. Um, they're just like bored with, like, they're dealing with like normal stuff. It's like their brain is kind of already on to the next thing, right? I think you just become much better at what you're going to do. I think that's the easiest answer. I mean, Tapley, you were an adult with ADHD. You had the TruDose. Are you better now than you were before?
I mean, I mean,
lose anything.
you know, I can retain and recall many, many, many things. And, it's not like I'm biologically getting improving as I'm getting older. I'll be, 48 in a year. So we don't biologically get better. And, I would argue that I've learned more, the past decade, just like in, my affinity to want to learn has exponentially increased than when I was, say, in my formative years, which is, I mean, that's not how we typically operate.
Hmm.
Um,
Just
there's a,
become better.
there's a question here about PTSD and different types of modalities. Uh, Basically, mental health conditions, I'll just summarize it as this, is that if you've experienced emotional trauma and there's PTSD of anything, and I've seen this firsthand many times, whether it's rape, whether it's the war, whether it's my abusive marriage, you saw your parents were abusive to one another as a kid. What your brain does is it protects you from those events, as that event that you saw, you experienced, ravages your body top down. It makes your whole body stop, working in ways that are normal, you know. And that's meant to be temporary as your body tries to fix those things, and down below the body, and it means to come back up and fix the brain. But the longer that event stays unaddressed in the brain, eventually the neurological connection becomes cut there, because your brain is trying to protect you from it. And so what happens is that you can talk it out, you can counsel it out, but that event is not going to get out of you. Even if you try to forget it and it was there. Basically, I know this from experience, because there was about a 10-year period of my life that was a black blur. I mean, I just couldn't recall it. Just trauma. And I now can recall every bit of it. And I can say this, I've seen this firsthand with people that have experienced PTSD. If you get this treatment, you will likely re-experience that event again very soon in, say, your dreams, as a way of processing. That neurological connection is reestablished, and there's no emotion to it. It's not going to destroy your life. It's merely your body saying, I'm now at a state where I'm allow you to process this, and basically detoxing a PTSD event.
Right.
And people they get up the next morning and they say, no, it didn't affect me. I feel like I can move on. But that's what I would say. That's probably the time when you need to intervene and talk it through with a professional and detox it that way.
Mhm. Yeah, there's different ways to work on that. So I don't know if was there any questions that we missed here? I think dementia, I thought I saw before, Alzheimer's, any case experiences with those?
Yeah, I mean, my mom has dementia. Um, we treated lots of people with dementia, Parkinson's, these things that um, where you're just you're neurologically and you're cognitively just severely impaired. And I can tell you the dementia, the memory, I mean, it starts turning on. My mom, I mean, she had to move, and that, which is it's not for this call, but when she came to Texas and I said, I need to take care of you. Uh, Long story short, I said, I need to get this treatment into you. Because she was in a very bad place. Within 24 hours, I get a phone call from her, and she's, you know, telling me how first she was rattling it off at just a lightning pace for her, but she needs to get in touch with her financial advisor and talk about these different investment things. First of all, she doesn't have any of those. Um, but it was funny that she felt that she had to get on the phone and start talking about this stuff, which is for anybody it's probably complex, but for her it's like infinitely complex.
Mhm.
And she started recalling things that happened to her when she was in third grade. So there was a lot of not just memory, but a lot of emotional healing that she was going through. So yes, We've seen those cases. It definitely helps. It's one of those multiple treatment type of scenarios.
So I know that some people we're coming up. Wow, been on a long time. That's great. So I'm gonna we'll be wrapping up. If people have some more questions, you can ask them here. But just to let you know, Tapley, you're coming out this coming week, Monday, Tuesday. We actually have people scheduled up. I think we may have a couple of openings still. But you will need to let us know soon if you want to do the TruDose treatment, because we have to get you in with a visit with Dr. Johnson before that time, and I want to make sure you guys can get the experience because it's pretty freaking awesome, as you could tell. And you can call the office tomorrow and 203-371-8258 and speak to the girls at the front desk, see if you can schedule that so you can get into your TruDose session. I think we have some openings in February as well, but this would be the best time, obviously, to take advantage of that if you can. So is there any other questions? So I'm not seeing, I know a bunch of people had to leave, but we hopefully will have a recording of this meeting so that we can get that to you, to everyone who registered for the call tonight, and you'll be able to learn about it. I'm sure you'll have more questions, but anyhow, so that's that. I appreciate you guys coming on, and Tapley and Elena. I don't know if Elena's still here, and Dr. Johnston, and we'll see you next week.
Yeah. Thank you, gentlemen. Thanks,
Yeah,
Tapley.
thank you for having me.
All right. Have a great night. Take care, guys. Bye-bye.
Have a good night.